2:3去到4:2。
This session will go from 2:15 to 4:20. Deputations and individuals, please note that you have a microphone and an earpiece in front of you. Channel 0 is the floor, Channel 1 is Cantonese, Channel 2 is English, Channel 3 is Putonghua. Your oral remarks and submissions are not covered or protected by the Legislative Council Powers and Privileges Ordinance, Cap 382. So you need to take responsibility for what you say here and also what is in your submission. In front of you, you also have a notice to the public attending meetings in the Legislative Council. If you need a copy, please get one from our security staff. Each deputation will have 3 minutes. From the Bureau, we have the Undersecretary for Food and Health, Dr. Chui Tet Yi. Also, Deputy Secretary for Food and Health, Ms. Amy Yun. Mr. Alice Lai, Assistant Commissioner for Customs and Excise. And also, Dr. Feng Ying, Head of Tobacco and Alcohol Control Office. And also, we have Dr. Danny Lam from the same office. It's time to start. Seat 74, Mr. Chong En-ji. I am a student at the Public Health Department of Hong Kong U. On this issue of new tobacco products, I agree that the administration should do something about this. I have talked to smokers. They have used e-cigarettes. They think that it is more difficult to control the take-in content of nicotine. Now, some people say they may be helped or actually not helped because it will be more difficult for them to quit smoking as a result. For young people, if they start with e-cigarette, they may be lured to use conventional tobacco later. The administration must take a preventive role. You must ban e-cigarettes. There are many toxic substances in e-cigarettes, including formaldehyde. And also, there are other unknown substances which have not been studied into. And we don't know the long-term effects of these substances. I think we should ban them first and gain time for studying into these harmful substances. I'd like to remind you, you have 3 minutes. Seat 75, Ms. Lam Kai Wong. Thank you. My stance is that I support a total ban on e-cigarettes, HNB products, and other new alternative tobacco products. Many people who object to the proposal say that they have switched to these new products and they cannot go back to conventional tobacco. So it seems they are being helped. I'm a non-smoker, but my family members and some of my friends are smokers. They said it was difficult for them to quit, but none of them used e-cigarettes or HNB products to help them quit smoking. This shows that you can speak your own mind, but this is not evidence for you to say you support or object to the proposal because people have very different experiences. Therefore, we have to go for disinterested evidence. And now scientific evidence is such that there is no evidence saying that e-cigarettes can help quit smoking, but actually they are also harmful. And then people who support are usually having a conflict of interest. And we must be very careful and cautious in interpreting their explanations. There are 6.74 million people who do not smoke in Hong Kong, but 660,000 smoke. But this should not be a debate between the two parties. We can coexist in peace. You know, even if your father smokes, he is still your father. So we should speak in the interests of the community, and please do not only listen to the tobacco community who want to make a profit out of smoking. Hong Kong has been very successful in reducing the prevalence rate, and without these new products, I believe we will have the end game soon. But then tobacco manufacturers are not happy. They are promoting new products so that there will be more people using tobacco, and they are actually saying that this is good for your health. But can you believe them? Tobacco manufacturers have always objected to controlling the use of tobacco, but now they say they agree. So actually they are looking at profits. If we do not impose a total ban now, if we only seek to control it, then we will be repeating the experience with conventional tobacco in that it is very difficult to kick it out. And we will not have the end game anytime soon. As an average citizen, I hope legislators, well, there are not many of you here, I hope you will not fall into the trap of tobacco manufacturers. You are elected by Hong Kong people. You must have in mind the health of Hong Kong people and vote on Hong Kong people's behalf. Ms. Mok Hoi Yen, 76. I strongly support a total ban on e-cigarettes, HNB products, and new tobacco products in general. I'm just an average citizen. I'm here today to tell you that you should have in mind the community's wealth and make the best use of human resources. New tobacco products can have a renormalization effect, but the WHO has already said that any tobacco is harmful to health. E-cigarettes and HNB products are carcinogenous. We have formaldehyde and other substances. But e-cigarettes are designed like toys that in fact they are sugar-coated toxins. The Hong Kong U has said that there are about 30,000 secondary school students and 2,000 primary school students had tried to use e-cigarettes, and the youngest one was 9 years old. Do we want such tobacco products to harm our next generation? Since you know that e-cigarettes and HNB products are harmful to health, the administration must ban it before people form the habit and before these things take root in Hong Kong. A total ban is to prevent disease, protect public health, reduce medical expenditure, and making sure that social resources are reasonably distributed. The social cost that will have to be borne will be higher than the tax or duty that will be gained, and it was shown in 2011 that the social cost was $5 billion and the duty collected was only $4.2 billion. Smoking can bring about air duct diseases and lung cancer, and this will add a burden to our existing medical delivery system. We have to work on all fronts to do something. We need to tackle air pollution, and smoking is helping to put more dirty air into the lungs. I am of the view that we must not put the cart before the horse. The administration's consideration must be public health and not to prevent fires, as some people say. Some people also say that we should allow these new products to be processed in Hong Kong. In other words, we are only asking other people to take more of the harm. So it's the same as exporting rubbish to other countries. Can we have a clear conscience when we do that? Will you take your own rubbish to your neighbor? Of course you won't. 77, Ms. Ha Mei. Good afternoon. I'm here to support a total ban on e-cigarettes and new tobacco products. E-cigarettes and tobacco, conventional tobacco, are not that different, but recent promotion has put a positive label on e-products. It seems some people are giving e-cigarettes as a valuable gift to one another. While parents don't pay attention, young persons are taking to this positive image created by advertisers. Many young people, after taking e-cigarettes, will switch to conventional tobacco. My father is a long-time smoker. He did not succeed in quitting, tobacco, and he now regrets the harm done by tobacco. If he had not started to smoke when young, he would not have to go through the pain of cessation. There will be harm done to health by e-cigarettes. Considering the harm that can be done by such tobacco products and the cost that this will entail, and we have to consider the economic cost, and we must do a preventive job and impose a total ban. Before it spreads to more people, it should be banned. Also, we need to consider the non-smokers. There will be a lot of second-hand smoke that can harm people. Say, I am allergic to tobacco smoke, and I feel like I can be suffocated if some people smoke. And say, if somebody should use e-cigarettes next to me on the bus, I feel that I'm quite suffocated. Therefore, I hope there will be a total ban on new tobacco products. Mr. Chang Wing Hong, seat 78. Good afternoon, Chairman and members. I'm from Shenzhen City. I am the chairman of the e-cigarettes society in Shenzhen. I hope members should have an open attitude towards the new products. You must understand the feelings of the community and put up constructive proposals. We understand that you are concerned about the harm done to health by smoking. We know that you think there is a negative impact on health, but about 700,000 Hong Kong adults are smoking. We hope they can have a choice of modified risk tobacco products. And this will also reduce the harm done by second-hand and third-hand smoke on bystanders. And this is a transitional product leading people to cease smoking. I hope there will be appropriate regulation instead of a ban. In fact, the health impact is really very low. You should not deprive smokers of choice. Under the Basic Law of Hong Kong, smokers should have the freedom to choose, and they should have the freedom to smoke. They should not be deprived of these two freedoms. Our association promised that we will strictly abide by Hong Kong laws, and definitely we will not sell such tobacco products to minors, including e-cigarettes. If you ban these tobacco products, smokers will just have to take the risk and buy smuggled cigarettes. And when smokers get such products from lawbreakers, it will even be worse. I hope you will not allow this to happen. I hope you will do appropriate regulation so people can have a choice. Next, Ms. Gurang.
Support total ban on e-cigarette and any other form of alternative smoking product. I'm a healthcare professional and I work in a smoking cessation service. In the past 8 years, I've seen thousands of smokers. They're local, ethnic minorities, and new immigrants. For many of them, we have managed to help them quit successfully. However, many have relapsed, and they're still struggling despite of our assistance and their own intention to quit. One of the main reasons is cigarette is available easily, and then in the past years, we have seen that more women and increasing trend of younger people. Furthermore, I have also observed that there is tendency of starting e-cigarette and heat-not-burn products, and then as an alternative. And then there's a survey from Hong Kong EU that among the primary school students, there's an increase of 55% from 2016-17 to 2017-18. So, and then there's also survey in US. E-cigarette use among the high school students in 2018 was almost 14 times more than in 2011. And e-cigarettes are marketed in such a trendy way, and then that targets non-smokers and women and youth, making them a gateway to smoking. And some smokers are switching to this as an alternative product. I've seen them in my own case, cases at my work. That's why it's time to ban these products. We need to emphasize there is no safe and harmless tobacco product in the world. Increasing number of research studies have revealed health impact by using e-cigarettes, heat-not-burn products, and any other smoking products. They are not the healthier alternative because they do contain and release various detrimental and carcinogenic substances. WHO has verified there is a limited and unconvincing evidence of e-cigarette and other new smoking products on smoking cessation. Thus, these products are not the legitimate tool for quitting smoking. That's what I've been telling my cases at my work. To protect the health of public, especially the younger generation, the government and legislative council should take this bold step. As an overseas experience shows that regulatory approach on smoking, e-cigarette and other new products is not able to prevent its epidemic among youngsters. However, total ban has shown positive impact. Thus, total ban is the only way to prevent current, future health risks posed by the tobacco epidemic, including e-cigarettes and heat-not-burn products. Thus, I urge the government for immediate passage of smoking bill to prohibit the import, manufacture, sale, distribution, and advertisement of e-cigarette and other new smoking products to protect public health. Thank you.
Ms. Lian Ha, seat 80. Chairman, members, good afternoon. I am in media work. I'm a smoker. I object to the total ban. Very often, I go to different places, like to Korea and Japan. They are very clean places, and it's very clear that very often people switch to using HNB products. But I want you to know the difference between e-cigarettes and HNB products. They are different. If you want to ban these products, you have to look at data and see what these products actually are. What harm do they do? What impact will be there for other people? In Japan, they will tell you that HNB products is such and such, and e-cigarettes is such and such, and tobacco is such and such, and then you can make a choice. And they would say that you can smoke only in some places, and you can buy tobacco at what age and where you can buy tobacco. Everything is laid out very clearly. It's a kind of very clear system for regulation, and I think it's very effective. You know, people take time to quit smoking. I know smoking affects other people. But if we choose HNB products, that's because we don't want to affect other people. This is my own experience. Say the odor and also the secondhand smoke produced. In fact, we are reducing environmental pollution. So why don't I do something which is affecting people less? Why don't you go for regulation so that we can follow certain guidelines and not just for you to tell me no, no, no. And if you talk about harm, many other things are more harmful, like online bullying and in the electronic media. You should go regulate those. People, like young people, they play games online, they go to social media. In fact, that does more harm to them than smoking. In fact, many young people are very healthy. Well, this is because we have done our education well. Parents are also telling them, well, when you say there are many young people smoking, I don't think so. I don't see many new generation young people smoking. I think we, our generation, smoked more. This is my own view. I hope the administration can listen to people like us who are the users, who are smokers. Thank you. 81, Mr. To Wai Chen, Chairman, good afternoon. I'd like to say that I'm a smoker. The first time I got in touch with tobacco, I was in my teens at that time. If you say smoking is bad for the new generation, then will HNB products cause more young people to smoke because it is easier to start? Well, I think it should be up to the individual to choose. Many of my friends don't smoke. It is an individual's choice. Don't blame it on HNB products. Don't say that there is such a product and so many more people will smoke. I don't agree imposing a total ban on alternative smoking products. If you compare H&B products and conventional tobacco, well, there is no tar content in H&B products, and there will be less harm to the environment as well as to the human body. Well, you can see it, you can feel it. And if you want to ban H&B products, then there will be a blurred interpretation of tobacco. Conventional smoking is also using tobacco. Why don't you ban that? And actually, H&B products are less harmful. Why do you want to ban this one and allow a more harmful one to stay? I don't understand. And even if there should be regulation, there must be a report, consultation, a discussion, and there must be a transitional period instead of a sudden jump to a broad brush approach. It is not that with a click on your finger you can cause H&B products to disappear.
個做法
I think there could be the same regulator approach towards traditional cigarettes. The H&B, you can through increased taxation, and as the young people not to refrain from smoking, they will achieve the same result. The difference is that one require a lighter to combust, the other actually by using aerosol method. There isn't that much great difference. Why do we target H&B products? Well, I don't know much about e-cigarettes and don't know what are the composition of the e-liquid. So the government can first produce a report to let the public know the difference between H&B and e-cigarettes, the differences, and the way of intake. Just can't use one broad brush to treat them as the same, to misleading the public to confuse them as one. Thank you. 82, Mr. Philip Million Lai. I don't have a lot of data and studies to support what I'm going to say, but I would like to share my personal experience and anecdotes. I state my position. I object the government's proposed total ban on these emerging tobacco products. I'm an ex-smoker. I smoked for 10 years previously until I met my wife. My wife is asthmatic. Even though it's under control, but you know that you can't be eradicated and can relapse at any time. And also his nose is very allergic and to air quality. So let's say we're both on the street and we smoke next to her, then she will feel discomfort right away. Let's say after I have the cigarette and when I return home and met her, whether I passed by or sitting next to her, she would know that I just had a cigarette and her nose would feel bad. So when I married her 10 years ago, I decided to quit. However, just my start quitting can reduce her discomfort because we still need to go out. Well, either the people smoking next to her or after they smoke, they walk past her, and my wife had this discomfort reaction. So we try not to go out as much, however, you kids can't avoid them altogether. Well, Hong Kong streets are crowded, and you can't avoid it. Sometimes you just can't escape from them. So since some people switch to new tobacco products, whenever we walk past those users, my wife doesn't have as much a bigger reaction. So sometimes we met people smoking on the street, or we have friends who smoked and socialized with them. My wife showed a different reaction than traditional smokers. As this product mature, they will only improve, and so my wife can able to go out more. And now the government proposed a total ban. You can imagine that how disappointed we are. So if this bill is passed, you're forcing them to stay in home and seclude herself from the world. So I urge the government to examine this. The non-smokers are not all happy with the total ban because it will also affect them, how they can re-examine your position. so that we can answer to our aspiration for a clean environment. 83, Mr. Choi or Ivan Choi. I'm against a total ban of e-cigarettes and HNB. After listening to so much deputations, it was what the previous public hearing. I believe that a lot of people in Hong Kong are not clear what e-cigarettes and HNB are all about. I don't know much about e-cigarettes. I know there's a e-liquid. I know a bit more on HNB. So what is HNB all about? It's just the HNB ground into fine particles and add water. So let's make it become a chunk fine and dry it up and roll it together. And so it becomes a cartilage. So it uses a metal strip to heat up. Compared to the traditional cigarettes, some ladies claim that they're all the same. That's a huge difference. The traditional cigarettes can reach as high as 900 Celsius or above, and HNB by heating by metal strip only get to 450 Celsius. A lot of the carcinogens and harmful substances can be released under high temperatures. For 450 Celsius, a lot of the harmful substances and the carcinogens have not been released. But does that mean HNB is the next big thing? Nobody wanted to argue that. It's just a matter of comparison as a lesser evil and less harm. As smokers, when we choose the less harmful option, now we are deprived of the opportunities. Not only we're disappointed, we felt, is this just so authoritarian and my way or the highway? Can you just give us back the right to choose? So the product is available, including HNB, e-cigarettes, and traditional cigarettes. Just let us have the choice. And now everyone claiming this and that, and someone described the end game. If anyone knows what is the end game all about, the target is to reduce the smoker prevalence to the global level of 5% of the population. Hong Kong is currently is about 10%. So Sophia Chan, Secretary, said that with step one, we'll get to 7.5%. So I forget the exact time, probably like 12 years or so, and to 7.5, and finally get to the end game of 5%. I found that preposterous. So the end game of 5% for the sake of your health. Why not just make it 0? You're not confronting square on. Now you are taking it away outright while holding the moral high ground of the banner. You serious? Of you so good just have a total ban? While Secretary Chan and others not able to give a direct answer. Well, at the previous hearing at 13th, they have been questioned by members multiple times, refused to give an answer. Well, for government to demonize this, I feel I have to speak out. But I believe or not, I can choose not to smoke. I can just smoke a few cigarettes or not going for that week. The time is up. 85, Mr. Hon Kwok Chung, Sam. I'm in the hairdressing business, also a owner of a hair salon. So I frequently need to go on business trip. Also, I'm objecting a total ban. When I grow up, I fully understand the harms of traditional cigarettes because my mom died of bronchitis. That it was a tar that actually aggravated emphysema. So it was very unfortunate. And when I was young, since I grew up and after and in the business, I've been taking in a lot decades of secondhand smoking. Due to my work, my friends and my colleagues and my customers are smoking, and yet I'm not a smoker. And for the past few years, when I discovered H&B and e-cigarettes, at least I found my surrounding environment. I felt that I can still able to survive instead of shrouded by secondhand smoking brought by my colleagues and family members. In service industry, with everything to do with beauty, as the H&B and the e-cigarettes have greatly enhanced our work environment. If the government decides to have a total ban due to health concerns, why don't we discuss a total ban of all tobacco products? If the deputations before me see that it's so important and so beneficial to human health, why the government just have across-the-board ban? And then there will be no room for dispute. So H&B e-cigarettes does not need a total ban, but rather regulation, including the e-cigarettes, the composition of the e-liquid, where the government can regulate, through import by better gatekeeping. And the gentleman before me claimed the H&B data. I've looked over them. So they actually heat instead of burning that achieve harm reduction. So I hope that we understand what it means by a better choice. So they give me a choice for smoker and non-smokers, and unlike those who on the more high ground to decide on behalf of everyone. If they insist on doing so, I would say that I say yes to a total ban of all tobacco instead of just H&B. '85, Mr. Choi Yu, Eugene. I work in electronic media. Well, I've been smoking for over a decade. Well, you can say I'm blaming that I do smoke a lot, and the worst, I can do 2 packets a day. Well, last year I was married, and the family members are mostly non-smokers, and hope that I can quit. And also want to quit. However, I don't do H&Bs. Well, I tried it, but not frequent. I usually stick to traditional cigarettes. Why? Because it's easier to buy. So you can buy it legally in Hong Kong. And now on the proposed ban on H&B and e-cigarettes, I definitely say no. Because I'm thinking of quitting. And we're trying to look for substitute products, for example, nicotine gum and nicotine patch, and felt that doesn't do work on me. H&B, there's no difference when puffing. Those I would feel a bit better. Not only I no longer have the odor, or then my mom would not ask me to smoke H&B on bed, otherwise my bed would caught fire. I wouldn't consider what kind of chemicals that will do damaging to your health. I'm sure that those who smoke would know that it's bad for your health. It's really some kind of bad habit, and I don't want to affect those around us. So I feel that this H&B compared to conventional cigarettes is a rather good choice. Option rather. If something can fully replace a more harmful, isn't it? Is it a better choice? And it's proven that it does reduce the impact. For example, the secondhand smoking, at least you, a lot less odor can be felt, rather than having across the course ban, rather than you throwing the baby with the bathwater, like the gentleman before me. If you decide to ban e-cigarette H&B, why not a total ban, and yet you skirt away from it? So is the government pushing us to die? Isn't traditional cigarettes more harmful? Well, the classic economic is called Matter of Choice, and you also have a magazine called The Choice. I just want to be given a choice. Thank you. 87. Mr. So Yip. The government total ban of mixing HNB and e-cigarettes is misleading. So why did the government conduct a public consultation? Which I'm quite mystified. Well, you know that the HNB is demanded in Hong Kong. A total ban will only make those who on HNB to turn to the smuggled cigarettes market, would allow the illegal elements to profiteer and expand the market, and actually push those on HNB to traditional cigarettes, which is even more damaging to their health and add to their healthcare burden. And this actually go opposite the policy intent and give rise to more problems. And the government claimed that led to more young people to get on smoking, and you actually solve the superficial issues, but give rise to others. And the government took the easiest route across the board ban. So why don't we have a consultation for us to discuss better solution? In 2003, when the government decided to legalize football betting, well, back then illegal betting on soccer was rampant, and the government crackdown had not been effective. And government knows that a total ban on soccer betting is difficult to enforce and impossible to stamp it all out. And finally, they provide a legal avenue for soccer betting, so they effectively reduce illegal betting and actually meet the needs of the public who would like to bet on soccer. And well, is there any benefits of alcohol to the public? So why don't we have a total ban of alcohol? There is certain demand for alcohol in Hong Kong, and difficult to have a prohibition. Ditto for tobacco products. To banning. Well, see, the advanced economies like South Korea and Japan, they've launched the e-cigarettes HEB for a few years, and you don't see there any major con effects. The technology is evolving. I think the HNB can replace traditional cigarettes as a less harmful option. I hope the government will not have a across-the-board approach, a uniform approach. Well, we don't have a say for MTR to raise the fares, and we don't have to say on the land how to more vision, but can we government the public make a choice when making their own cigarettes? Next, 88, Mr. Paul Arkwright.
Thank you very much for my lucky number. I'd like to start by saying I have absolutely nothing to do with cigarettes. I've never been a smoker. My company I'm representing is a media group, and we run a number of conferences, of relevance, a large amount of them are about human resources and about diversity and inclusion within the workplace. And I'll come back to that point in a moment. I'm not going to sit here and say that tobacco is healthy, nor that e-cigarettes and heat and burn products are healthy. They're not. The best thing for people in Hong Kong is to quit and not smoke. That's the healthy option. Now, the real world is that many people have already moved to heat and burn products or e-cigarettes. So there's already quite a large market for that in Hong Kong. One of the deputations mentioned that there's pretty limited evidence as to whether or not these alternative tobacco products are healthy or not. Probably the reason why there's a lack of evidence is because they're new to the market. So there hasn't been time for enough research on them yet. However, there has been research done by Public Health England in the UK that clearly shows that these e-cigarettes and heat and burn products are less harmful than cigarettes. So there does seem to be scientific evidence to suggest that although not healthy, they are less toxic and less unhealthy than traditional cigarettes. I think it is not the government's position to be putting a blanket ban on products simply because they're new into the market. This is against the free market system. It's against the freedom of choice for individuals in Hong Kong, whether they smoke or not, whether they want to use these. I fully support the idea that these need to be carefully regulated and they need to be run out with an education program to make sure that young people, particularly in schools that was mentioned before, are not using any of these products, either tobacco nor e-cigarettes or heat and burn. But to take away people's choice seems the wrong thing to do. If you're going to give people alternatives, at least e-cigarettes can help them to find a less unhealthy alternative to smoking, and it may in time be proven to show that they can actually help quit smoking. So I'm against the blanket ban. I also think that that would simply push it underground, like the other deputations have mentioned, and that means illegal sale of such products in Hong Kong, which has two negative effects. One, there is no regulation on those illegal products, so people could be smoking anything. And two, just from a financial perspective, it's a huge loss of tax revenue for the government as well. So for those reasons, I do not support the blanket ban on e-cigarettes and HAB. Thank you.
好，唔該。跟住係89號位嘅魏珍利醫生。
大家好，我係代表香港胸肺學會咧去表明我哋係支持立法全面
Thoracic Society, and we're totally opposed to use of e-cigarettes, heat-not-burn products, and other new tobacco products. People have asked whether these products are less harmful than traditional cigarettes, but the answer is no. More and more international literature have shown that e-cigarettes and heat-not-burn products actually are bad for our respiratory system. They could have a damaging effect on our health. H&B products and e-cigarettes would increase the chances of bacterial infection in the lungs, and will also cause our airways to be narrowed. For those with asthma and chronic diseases, the effect will be most serious. In 2019 February, Australia released results of a survey which showed that all sorts of tobacco products actually are equally damaging to the respiratory cells in the human body. So H&B products, in comparison with conventional cigarettes, would be toxic to lung cells. So the researchers came to the conclusion that the new tobacco products cannot be a safe substitute for conventional cigarettes. It cannot be a safe substitute. In Europe, the Respiratory Society also pointed out that H&B products have a clear stance that is harmful and cancer-causing substances are the same as conventional cigarettes, and they're also totally addictive. And e-cigarettes will not help people quit the habit. It will not help people quit the habit of smoking. On the contrary, it will make people who want to quit have less drive and determination to quit. And this would increase the smokers' chances of consuming conventional tobacco products and e-cigarettes. We also worry that because the look of the e-cigarettes is so appealing and chic, that will cause minors, adolescents to be interested in trying them. So in conclusion, we think that e-cigarettes and other new tobacco products actually are like conventional cigarettes in that they are hazardous to health. And they could seriously affect our
future generations. So our society thinks a total ban on e-cigarettes, H&B products, and new tobacco products is needed to truly protect the health of our people and also the next generation. Thank you. Before I continue, let me say that after we have heard from 3 more deputations, I will adjourn this meeting for 5 minutes. Mainly because our deputy chairman is not in Hong Kong. I couldn't find someone to replace me, and I need to go to the meeting next door. So we will have to adjourn for 5 minutes after the following 3 deputations have spoken. 92, Ms. Chen Yao-man. Good afternoon. Thank you, Chairman. I'm speaking on behalf of the Pt1 Hospital, where acupuncture specialist center. I support the amendment of the bill to ban the import, sale, and distribution of the alternative smoking products, because the government all along has got various policies to encourage the public not to smoke and to reduce the widespread use of tobacco, and with the hope to reduce the effect of secondhand smoking on the public. So we think that we should continue to try various ways to reinforce control of tobacco. Our association all along has been organizing anti-smoking activities with the Tobacco Control Office. In our clinic, we've seen many patients who really want to quit smoking, and often they think that the secondhand smoke would not be seen by others. But when it comes to our treatment at our clinic, we would try a monodiazide exhaling exercise with them, and we found that they exceeded the limit, safety limit. So this people want to quit. Over time, they would reduce the habit of smoking, but their friends, after some of their friends introduced them to use e-cigarettes, and in the end they failed to quit and just switched to e-cigarettes. We've seen so many such cases. Therefore, our association hopes that the government now, since e-cigarettes are not yet very popular, we want to see a legislative amendment so that we would curb the spread of the influence of the conventional cigarettes. Thank you. Next one is 93, Professor Judith Mackay.
The Boeing 737 MAX. Now, the cause of the crashes are still uncertain, and regulatory authorities around the world have rightly applied the precautionary principle in the interests of public health and life to halt the use of these planes until the cause and the real dangers are clarified. And no Hong Kong legislator today, before the evidence becomes available, would either firstly risk travelling personally in one of these aircraft, or second, authorise the Hong Kong airport authorities to allow the 737 MAX to operate in Hong Kong and bear the responsibility of another possible crash. And so it is with these new tobacco products. You have certainly heard a wide variety of personal opinions voiced here in LegCo, but strict scientific data is only beginning to emerge. And remember that ordinary cigarettes have been on the market for over a century, and we're only now uncovering some of the harm they do. So legislators in Hong Kong have an opportunity and a real responsibility to apply the same World Health Organization precautionary principle to safeguard public health. 10 points. Firstly, we don't know what's in the hundreds of different products. Secondly, we don't yet know if they help smokers quit, or even the opposite, they encourage them to keep smoking with dual use. There's already a substantial body of evidence that e-cigarettes increase the risk of ever using combustible tobacco cigarettes amongst youth and adults. But we don't know their effect here in Asia. The first report in Asia was published only this month on 13,000 students in Taiwan, China. Teen vaping doubled the odds of youth taking up cigarette smoking 2 years later. There is appalling advertising from the US, and we do not want this in Hong Kong. Heat not burn and e-cigarettes are trendy, electronic products with great appeal to youth. They both offer a real risk of renormalizing smoking, just as Hong Kong has so successfully reduced smoking rates. The tobacco industry have told us twice before where they have a safe product, firstly with filters, and then secondly with low tar, which both turned out to be not safe at all. The global trend is for a growing number of both high, middle, and low-income countries to ban these products. And we've also heard, finally, that parents in Hong Kong do not want these products on the market. And once allowed on the market, there is certainly no turning back. So the suggestion of the Asian Consultancy on Tobacco Control is to ban all these new products, and secondly, to review this in 2 to 3 years, where there may be greater evidence on all these many uncertainties outlined above. So the issue is not whether e-cigarettes are safer than cigarettes, it's whether they are actually safe. Thank you.
跟住係90。
Thank you. The next one is 96, Mr. Ng Ong Hei. Thank you, Chairman. Our stance today is very clear. We do support a total ban on e-cigarettes and other new tobacco products. Why? Well, why do we think that e-cigarettes are so harmful? Well, let's focus our discussion on the impact on youths. The biggest harm is not because of the toxic substances or cancer-causing substances inside, or irritants or carcinogen. The more importantly, they are packaged as a trend, like a toy, and packaged as something that is healthy or non-toxic or causing less harm. Or even there could be a renormalization of smoking through these products. I'm always worried that one of the characteristics of e-cigarettes is it doesn't have the odor of smoke, but that causes the danger that parents and teachers cannot tell when the young people are smoking, and the young people also are not aware of themselves consuming tobacco. They don't know that toxic substances exist within them, and young people may be more likely to switch to e-cigarettes. So tobacco companies package them as something healthy, relatively healthy and non-toxic, with the ultimate purpose of encouraging young people to continue to use them so that they can gain more profits. Health may not be their own prime consideration. In Hong Kong, we've seen news about cases where children under the age of 10 are smoking e-cigarettes on the streets. Well, you can tell that it's worrying really to see quite a number of young people aged around 10 or to the oldest around 20 smoking e-cigarettes. It's really worrying, the sheer number of these people smoking e-cigarettes. Government control and other measures will not stop the trend because children and young people can easily obtain e-cigarettes from adults around them. Education and regulation are not enough. In 2017, even in the U.S., there are more than 2 million young people, high schoolers, who were found to be smoking e-cigarettes. In the U.S. back then, there were some sort of control, and some U.S. officials described that as something like an epidemic. So we don't want to see young people being tempted by e-cigarettes. Once they smoke it once, it's very likely that they would consume the smoke and even switch to conventional hazardous cigarettes throughout their adult lives. Well, in Hong Kong, there is a lot of support to help people quit smoking, for example, substitutes for nicotine. And there's no uniform view saying that e-cigarettes are healthier. In 2014, since then, a number of countries have banned the sale and import of e-cigarettes. So I think for the benefit of the health of the next generation, we should not let tobacco companies have their interest overriding that of public health. Okay, thank you. So now we have to adjourn this meeting for a few minutes. For calculation's sake, I think by 3:15 we'll resume. So deputations, if you go out to the left, there will be a drinking machine available, and then toilet is to your right. Thank you.